This station is designed to test your ability to perform a patient assessment of a victim of multi-systems trauma and voice treat all conditions and injuries discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have 2 EMTs working with you, and that they are correctly carrying out your verbal treatments you indicate. You have 10 minutes to complete this skill station. Do you have any questions?
I do not.
So you're dispatched out to a 1-car motor vehicle collision. A 53-year-old female has been ejected and thrown down a cliff. She's alert and breathing, and the police are on scene.
Okay. BSI, is my scene safe?
Your scene is safe.
Okay. I'm going to take any PPE precautions that I might need necessary. I'm on a roadway, so I'm probably going to do a reflective vest, an ANSI vest, something like that. Are there any other considerations as far as my PPE goes? Is there hazardous materials or anything that could be a problem?
There is not.
Okay. My environment, is it cold? Is it hot? Is it daytime? Is it nighttime? Is there any environmental considerations I need to take into
There is not.
Okay. And then number of patients. Is this my only patient, or is there somebody else in the car?
This is your only patient.
Okay. My mechanism of injury, you said I had a 53-year-old female, vehicle accident down an embankment, down a hill. Is she still down there?
She's up at the road.
Okay, so she's up here at the road. So that's my mechanism. Additional resources. I am going to go ahead and start an ALS unit to intercept with us, and I'm going to start the fire department for vehicle considerations and stabilization.
Noted.
Potentially helicopter. So need for C-spine, I am going to take C-spine precautions just due to the mechanism. If I could get my partner to hold C-spine precautions, we'll go ahead and put a C-collar on and just hold until we get completely done and get her stabilized, and don't let go of it. So I'm going to put her chin here, and I'm going to tap you out here. And then over here, same thing. Okay, let's secure this. Okay. My general impression, I've got a 53-year-old female involved in a vehicle accident. Based on the mechanism, I'm going to assume she's unstable. Is my patient alert? What's her AVPU scale?
Your patient is alert.
Okay, my patient is alert, so I'll be able to talk to her. That's great. Level of consciousness, is she semi-conscious? Is she fully conscious? What's her level of consciousness?
She is alert and oriented.
Alert and oriented. Okay, perfect. Does she have any apparent life threats that I can see?
Just the bleeding on her back.
Okay, so if she's got severe bleeding on her back at this time, I'm just going to use a dry, sterile dressing. If I've got hemostatic dressings of some kind, I would use those. But otherwise, just dry, sterile dressings, we're going to go ahead and secure those. Does my patient have any chief complaints?
Just that her back's hurting.
Okay, there's nothing more I can do for that. I've controlled the bleeding. We've got ALS en route for pain medications potentially. So at this point, I'm going to assess my patient's airway. Can you open your mouth for me, ma'am? Can I see inside your airway? Do I notice anything in the airway?
Nothing in the airway.
Airway's patent. Okay, now I'm going to assess the breathing to make sure that my breathing's okay. I'm going to listen to lung sounds bilaterally, upper and lower. Big breath for me and out of your mouth. Again. And over here on this side again.
Lungs are clear and equal bilaterally.
Okay. So now I'm going to check circulation. Was there any other major bleeding besides the back?
Nothing noted.
Okay. I'm going to check my skin color, temperature, and condition. What are those things?
The patient's flushed, warm, and moist.
Flush, warm, and moist. Okay. At this point, I'm going to check pulses. So do I have pulses in both arms?
Pulses are present.
Can you wiggle your fingers for me on both hands? Okay. Which finger am I touching over here?
Pointer.
Which finger am I touching over here?
Thumb.
Okay. Pulses down here, or pulses present in both legs?
Pulses are present.
Okay, on your right foot, can you push down like a gas pedal? Lift your toes toward you. Left foot, can you push down like a gas pedal? Toes toward you. What toe am I touching?
Big toe.
What toe am I touching?
Big toe.
Okay. At this point, I'm not going to consider treating the patient for shock. She doesn't appear to have signs of shock. She is, however, going to be a rapid transport just due to the potential of internal injuries secondary to her accident.
Noted.
So at this point, I'm going to do a full head-to-toe assessment. My partner is going to go ahead and get sample history and vital signs. For those vital signs, do I have a pulse?
You do.
What's my pulse?
134 beats per minute.
Rate, and what's the quality?
It is thready.
Thready, okay. And I'm gonna go ahead and get a blood pressure. What's my patient's blood pressure?
The patient's blood pressure is 156/90.
156/90. Okay, so she's not showing any signs of shock based on her vital signs. Anything noted significant in the sample history that the patient or the partner got?
Nothing noted.
Okay, we're going to do a head-to-toe assessment now just to check for any injuries. We'll remove any clothes that we need to find any injuries if she has any complaints. I'm checking for decap BTLS on the scalp. That's deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Do I notice anything on the scalp?
Nothing on the scalp.
So at this point, I'm going to check, are her pupils equal, reactive, round to light and accommodation?
Pupils are pearl.
Okay, I'm going to check the nostrils, any blood or any deformities.
Nothing noted.
Can you open your mouth for me? Check the airway, make sure the airway is patent. Is our airway patent?
Airway is patent.
I'm going to check the ears for any kind of cerebral spinal fluid, anything like that.
Nothing noted.
Okay. I'm going to palpate the neck. Do I notice any step-offs or any decap BTLS with the neck?
Nothing noted.
On the front, I'm going to check for JVD, tracheal deviation, decap BTLS. Anything noted there?
Nope.
Okay. I'm going to check the chest wall for dexterity and make sure that there's no decap BTLS. Is the chest wall intact?
Chest is stable.
Okay. I'm going to auscultate my lung sounds in the upper and lower chest to make sure that it's still clear while I'm here.
Still clear and equal bilaterally.
Okay. I'm going to go ahead and check the abdomen by pressing gently, and I'm looking for pain, rigidity, or any rebound tenderness whenever I push on that. I'm going to check all 4 quadrants. Do I notice any pain or any decap BTLS? Okay, we're also going to probably visualize that. We're going to lift our shirt or cut it if we need to. No ecchymosis, no any signs of internal bleeding there.
Noted. Nothing noted.
Okay, I've already treated the bleeding on the back. Did we notice anything back there besides the bleeding deformity-wise?
You do not.
Okay. We're going to check the pelvis. We're going to push in, push down. We're worried about any kind of pelvic fracture, any kind of crepitus, anything like that.
Pelvis is stable.
Okay. I'm going to check the legs after I verbalize the genitalia just to make sure that there's nothing remarkable there. Is there anything remarkable there?
There's not.
Okay. So I'm going to check the leg. I'm going to palpate down the left. Do I notice any decap BTLS in the left leg?
Nothing noted.
Okay. Is pulses present?
Pulses are present.
Okay. Can you push down on like a gas pedal? Lift the toes toward you. Which toe am I touching?
Big toe.
Okay. I'm going to check down the right leg. Do I notice any decap BTLS?
Nothing noted.
Okay. Can you push down your foot like a gas pedal? Lift your toes toward you. Which toe am I touching?
Big toe.
Okay. I'm going to do the left arm. Same thing. Palpate down. Is there any decap BTLS with the left arm?
Nothing noted.
Pulses present.
Pulses are present.
Can you wiggle your fingers for me on the left hand here? Okay. Which finger am I touching?
Thumb.
Okay. The right arm, same thing. I'm going to palpate down the right arm.
She has an obvious deformity to her right humerus.
Okay. Is it bleeding or open or anything like that?
It is not bleeding and it's not open.
Okay. So noted. And I'm going to move along and I'm going to go ahead and check. Are pulses present?
Pulses are present.
Okay. Can you wiggle your fingers for me on that right hand? Okay. Which finger am I touching?
Pointer.
Pointer finger. Okay. So we've checked head to toe. The patient is going to be a rapid transport. We're going to reassess her every 5 minutes. I'm going to go ahead and splint this arm. I'd probably use a triangular bandage, make a sling and swath just to stabilize that into a position of comfort.
Noted.
I'm going to check, is the pulse still present after splinting?
Pulses are still present.
Okay. Can you wiggle your fingers for me? Can you tell me which finger I'm touching?
Pointer.
Pointer finger. Okay. So after splinting, she still has pulse motor sensory function. We're going to continue to reassess every 5 minutes. I'm going to get new blood pressure and pulse. What's my blood pressure?
Blood pressure is 142/82.
142/82, okay. And what is my pulse rate?
128 beats per minute.
128 beats per minute. What is my respirations?
19 breaths per minute.
Okay. And what's the quality?
Quality is good.
Okay. And let's check some pulse oximetry while we're at it.
Pulse oximetry is 98%.
Okay, 98%. We're going to reassess the patient every 5 minutes until we meet up with ALS. Continue to reassess and watch for signs of shock. She's not currently showing any signs of shock, but if she does, then at that point, we would put her on high flow oxygen, keep her warm, and put her in a position, a supine position. And this completes my scenario.
Thank you.